Well, South Africa's fight against the coronavirus will gear up when healthcare workers begin receiving the Oxford-Astrazeneca vaccine this month. The Health Department has reached an agreement with India's Serum Institute for the supply of at least 1.5 million doses, 1 million doses to be delivered by this month. The announcement was made by Health Minister Dr. Zweli Mkhize at a parliamentary briefing where he confirmed government's commitment to inoculate enough South Africans to achieve herd immunity against the virus. Well, we're joined now by the Health Minister via our video line. Minister Mkhize, it's great to talk to you once again, the second time this week on the AM report. Let's begin with what was received with such happiness yesterday, that announcement that you made in Parliament, 1.5 million vaccines on their way to South Africa. The first question I have for you, is this enough for all of the healthcare workers in our country? And if not, how do we decide who gets the vaccine first?
Well, thank you very much. The availability of this vaccine is actually a real boost in our fight against COVID-19. We were very pleased. We had said in the earlier press briefings that we were not at liberty to pronounce on the concrete issues in relation to the numbers and timing. But since we have been able to get a confirmation, we've been able to announce the first batch, which is the 1.5 million vaccines that are coming. It's not enough for all the health workers. It's still just the first batch that we are receiving. We're actually continuing to order more, and out of that, we'll be able to cover everyone. Now, the approach that we're going to take in the distribution or in the administration of the vaccine is that we'll be setting up centers where the health workers will be taken through. So we believe that by the time we'll have administered all of those dosages, it would be in such a way that we would be able to get additional doses to be able to give them the second dose. So the first 1.5 million, we should really be able to cover with that, but we will have been able to ensure that there are additional doses. So the ordering or the acquisition is going to be on an incremental basis based on the ability of the manufacturers to supply us. But we must know this is just a start. There are many, many more people that need to get the vaccines. And out of that process, we'll be able to make sure that those who need to get it will be able to get it.
So, Minister, if I can just ask you, this AstraZeneca vaccine, it's a 2-dose vaccine. The way that we're going to administer it, are we going to, when we receive that first batch of 1 million doses, are we giving that to 1 million healthcare workers and then the next batch will ensure that second dose? Or are we going to do it the other way where we give it to 500,000 healthcare workers, ensuring that they get that second dose?
It's a moot point at this stage because we are actually continuing to order. So we could be in a position to announce additional doses at a certain point, and out of that, we will then be able to determine whether, in fact, the best is to start with half the numbers. The reality is that there's still going to be logistical issues that we will need to put in place so that the numbers that we can vaccinate within a period of 1 month, we need to be able to say at that point that we are doing, the full one dose each, or we're going to be redoing them. It takes about 21 to 28 days to to give a second booster dose. So there's enough time to be able to get additional doses. My first inclination would be that we give the first 1.5 million, and in the process, we'll have been able to cover those who will need a second dose within the allowed period.
Minister, you've also said that it won't be compulsory for South Africans to take the vaccine. In terms of herd immunity, how is that going to work in our achieving herd immunity?
Well, we get always put on a bind. I don't want the vaccine, and government can't force me. We don't want to get into that issue. At the moment, there are enough people who will be open to accept the vaccine, and we believe that there will be many enough South Africans who will get the vaccine for us to be able to get the herd immunity. The approach on the vaccine is that we motivate someone to be able to take the vaccine. There's no law that will take someone to prison for not taking the vaccine. Just that people need to understand that there are responsibilities associated with the choices they make. And therefore, we think that if the major responsibility for government is to try and provide a safety net for all South Africans through the vaccine, people need to understand that, so that if someone doesn't take it, it's really up to them. But I don't believe that we have a huge problem of people who are going to not want to have the vaccine when we've got such a huge impact of the COVID-19. What we are seeing are concerns of people who are not sure about safety of the vaccine. There are all sorts of stories on social media. So we just need to be able to assure people out of that, because people are really wanting to get answers. Why is this, what is the safety issue associated with the vaccine? Can we be sure it's it's such a new thing, and so on? With time, that will wane away. So I believe that we'll be able to get people to get the vaccine without really lots of challenges. We do have to put up a huge communication campaign to make people understand that all these stories that are coming out are not necessarily true, and all of them, or some of those stories, are not going to help us as we're trying to battle this very serious illness.
Minister, I just want to ask you this quick question before we move on. There are also reports that India has in fact barred the Serum Institute from exporting this Oxford-Astrazeneca vaccine until India itself is covered for vaccines. Just give us some clarity on that once and for all, Minister.
Well, we have heard about that. We have spoken to Serum Institute. They've seen the report. They were not aware of this. We've had our president being in touch with the Prime Minister of India. So we are aware that India is also trying to boost its own reserves. But at the same time, we've got an agreement that we're going to get the vaccine. So whatever the news there was, we, from where we sit, we are going to get the supply. In fact, we're not the only one. In fact, I was talking to the CEO of Gavi yesterday on the COVAX facility. They are actually expecting some of the stuff to come from India, and they're just waiting for the manufacturing schedule. There is no issue about stuff being bought from India. So we can't explain why there was such a report. We're still comfortable we'll get the supplies.
Minister, the last time we spoke, I asked you the question about whether we know how much vaccines are going to cost us as a country. You couldn't answer before. Can you give us that answer now?
No, you will not get that answer directly, because we can just give an estimate that at the moment we will probably be spending just around 150, less than 150 million to get these vaccines. I can't give you an exact figure because we have to get once it's calculated, and we can give you an exact figure at that point. However, what makes it a bit difficult to give you one number is that you may get so many millions from this company and so many other millions from another company. It's a multi-supplier program where we get different vaccines because of the supply shortages. And therefore, you can never give an exact figure until you know who's been able to supply you a certain amount, and therefore you can calculate from that point of view. Largely, we can't just say that we have budgeted adequate funds to be able to fund the supply of the vaccine that we are going to be ordering from the fiscals, but we are expecting some additional support from the medical aid schemes and the private sector donations. But we can only announce once we've concluded it, because only then you know for a fact what the numbers are.
Minister, another big story this morning is that Aspen may well start manufacturing the Johnson & Johnson COVID-19 vaccine by late March, by early April. Minister, what is the benefit, if any, of a South African pharmaceutical company being involved in the manufacture of a COVID-19 vaccine here on home soil for South Africans?
Well, this was announced last year. This agreement, we welcomed it because it will be the first time that there's some work done on vaccines in the continent. So it's a huge achievement for the continent to have such capabilities. And we're hoping that in future we can build on it such that we are able to get more and more manufacturing capacity built, and therefore we can do some of the stuff within the continent. It's a very, very important issue. Secondly, Aspen does not have its own original vaccine, so they don't have a decision-making capacity on their own. So if you've got J&J giving them authority, in this case they're a contracted manufacturer, which means they contract for what already has been ordered through the J&J offices at the global level. And then in some cases, like in the Serum Institute of India, they've got a license, which means they can manufacture, and they've got a little bit of a discretion in terms of who they can supply. So the advantage for us is that whilst it's coming from the continent, we can have leverage to go and argue with Johnson & Johnson that they cannot have a continent manufacturing with the workers, with the facilities from the continent, and they ship everything out into the rest of the world, well-to-do countries that have already bought, and they leave the manufacturing countries behind without any contribution. So what it can give us is a leverage. It doesn't really automatically translate into an allocation for Africa or for South Africa. That's an issue that we're busy discussing behind the scenes. And so we can leave it at saying that it is an advantage that we can leverage on it on the basis of a moral obligation after all of us are buying buying the vaccines. We're not getting donations. So to go and sell to someone who's already paid money when you've actually got a country that has provided the base for manufacturing and leave nothing there, it will not be moral.
Absolutely. It seems only fair. Minister, thanks very much as always for joining us here on the AM Report. Dr. Zweli Mkhize is our Health Minister as we get you up to speed on the latest on our vaccine situation in our fight against COVID-19.